Did you know that the day you leave the hospital is statistically one of the most dangerous days for your health? It sounds backwards, right? You're getting discharged because you're better, right? But study after study shows that nearly 20% of patients experience a medical complication within 30 days of leaving the hospital. And the vast majority of those complications are entirely preventable. When the doctor walks into your room, signs that discharge order, and says you're good to go, a countdown clock starts. The hospital's job is technically done, but your job or your job as a family caregiver is just beginning. If you don't ask the right questions before your feet touch the pavement outside the hospital, you're flying blind into a broken healthcare system. Today, I'm giving you the exact step by step framework you need to execute before you sign those discharge papers so you can protect yourself or your loved one from a dangerous, unnecessary readmission.
Welcome to the walkthrough.
Before we dive into the first critical step, if you want to learn how to navigate the complex medical system, command respect from doctors, and ensure your family gets the best healthcare possible, hit that like button and subscribe to the channel. Turn on notifications so you never miss a guide on becoming an unstoppable patient advocate. Let's start with the absolute biggest culprit behind failed discharges, the medication mess up. When you're in a hospital bed, your home medications are often paused, substituted, or combined with entirely new drugs. When you leave, you're handed a stack of papers with a new list of medications. Here's where the fatal mistake happens. The hospital doctor assumes your primary care doctor will sort it out. Your primary care doctor assumes the hospital doctor got it right, and you are left staring at 5 different pill bottles, wondering if you're supposed to take the blue pill, the white pill, or both. You must demand a medication reconciliation before you leave the hospital. Do not accept a printout. Sit down with the nurse or the clinical pharmacist and ask, which of my pre-hospital medications am I stopping? Which am I continuing? And exactly what are these new prescriptions doing? The second blind spot is what I call the stable illusion. In hospital terms, stable doesn't mean you are healed. It just means you aren't actively dying or in need of acute, intensive hospital resources. Hospitals are under massive pressure from insurance companies to clear beds. They will push for discharge the second your vitals normalize. But stable in a hospital bed with a nurse pushing a call button is very different from stable at home, trying to walk up a flight of stairs to use the bathroom. If you don't feel safe, or if you don't know how you are physically going to manage basic daily tasks at home, you have the right to speak up. You're not being difficult, you're being effective. The third blind spot is the fractured follow-up. They tell you follow up with your specialist in 3 to 5 days. You get home, you call the office, and the receptionist at your primary care physician says, the earliest appointment we have is in 6 weeks. Meanwhile, your symptoms start creeping back on day 4. This communication gap between the hospital walls and the outside world is where patients fall through the cracks. If the hospital doesn't hand you confirmed scheduled appointment before you walk out the door, you're exposed. If you are watching this right now and feeling overwhelmed, I want you to take a deep breath. Do not have to memorize all of this, and you don't have to scramble to write it down. I have put together a easy to read, valuable resource for you, which is called the Patient Protection Blueprint. This is a comprehensive, downloadable ebook that acts as your ultimate shield during a medical crisis. It includes the exact scripts to say to doctors when you feel they're rushing you out. It also includes a master medication tracking sheet and a pre-formatted checklist you can hand directly to your nurse before discharge. Click the link down in the description right now to download your copy of the Patient Protection Blueprint so you can walk into your next medical appointment or hospital room with absolute confidence and organization. Welcome back. Now that you know the major traps, let's look at the exact steps you need to execute during the final 24 hours of a hospital stay. Step 1, identify your red flags. Every medical condition has a tipping point. Before you sign the papers, look the doctor in the eye and ask, what are the specific warning signs that mean I need to call your office? And what are the specific warning signs that mean I need to drive straight back to the emergency room? Do not settle for generic answers like, if you feel worse. You need specifics. Is it a fever over 101 degrees? Is it a sudden weight gain of 2 pounds in 24 hours? Is it a redness around an incision site? Get the exact metrics. Step number 2, the teach-back method. When a nurse explains how to change a bandage, manage a surgical drain, or give an injection, don't just nod along because you're eager to leave. Use the teach-back method. Say to them, to make sure I have this perfectly straight, let me show you how I'm going to do this at home. Physically demonstrate the task or repeat the instructions back to them in your own words. If you make a mistake, let them correct you while you're still surrounded by medical professionals. Step number 3, secure the durable medical equipment. If you need a walker, a wheelchair, an oxygen tank, or a hospital bed at home, do not leave the hospital assuming it will show up on your doorstep. Coordinate directly with the hospital's case manager or social worker. Ensure that the medical equipment has not only been ordered, but has been approved by your insurance and successfully delivered to your house before you get in the car to go home. Step number 4, establish the outpatient lifeline. Ask the case manager, who do I call at 2 a.m. on a Sunday if something goes wrong? Is there an on-call triage line? Is there a transitional care nurse assigned to my case? Write down that specific name and phone number on the front page of your discharge paperwork. That number is your medical lifeline. Polite silence does not save lives in a broken medical system. Your fear of being a nuisance to busy doctors and nurses is completely normal, but you must trade that fear for love. Love for yourself. If you are polite, respectful, organized, and firm, you're not being difficult. You're being effective. If a medical professional makes you feel small for asking a question about you or your loved one, that is a reflection of their ego, not your worth. You have permission to take up space, and you have permission to say, we are not ready to sign these papers until these questions are answered. You entirely possess the capability to navigate the system by staying calm, organizing your information, and standing firm. You can drastically alter the outcome of your medical care. You might literally save a life. If you found this guide helpful and want to go from a proactive advocate to an absolute master of navigating the modern healthcare system, I invite you to register for our premium program, the Healthcare Navigator Masterclass. This masterclass is a deep dive training program where I pull back the curtain on how hospitals operate behind closed doors. I teach you how to organize your medical records, create a healthcare biography, and how to manage your insurance paperwork to ensure you are able to decode the chaos to dispute incorrect medical bills and successfully appeal insurance denials. Click the link below to secure your spot and register in the masterclass that's coming up, and register it today. And finally, don't forget to like this video, subscribe to the channel, and drop a comment below sharing your own hospital experiences. Let's build a community of empowered, protected patients and advocates. Thank you for watching, stay strong, and I'll see you in the next video. Blessings.